Hello everybody, this is Dr. Nisarg Aravindan here. I'm an MD in Community and Family Medicine from AIIMS Rishikesh. I'm currently working as a family medicine physician and a public health specialist. Today, we're going to be discussing a few previous year NEET PG questions so that we are in a familiar ground when it comes to PSM. I would love to explain in detail about the various previous year questions, and I hope that you like and enjoy this video. So let's get started then. The first question is, a group of 30 young volunteers with prior lifestyle modifications has participated in a drug trial where cholesterol levels were measured before and after 9 months of statin therapy. Which of the following statistical tests should be performed to analyze the results? Now we know that it's the same 30 young volunteers who are going to be analyzed before and after. So it's before and after. There is a simple trick wherein it's like before marriage and after marriage. So they're both a pair. So before and after are going to be using the paired test of significance. So now since they are levels of cholesterol, so they're going to be numerical data, which is going to be continuous. So we can't use the chi-square test and we can't use the unpaired test, neither the McNamara test. We're going to be using the paired t-test in this case because it's going to be before and after measurement of continuous data. So this is about question 1. Next, this is what is a very simple table to help you understand how to go about writing the test of significance. First, we have the types of data here. We decide whether it's qualitative or quantitative. Let me start with the qualitative first. So if there are paired samples, okay, that means to say that if it's the same sample measured before and after, we do it as 2 sample test, then we say it as McNamara's test here. Now, because this is a qualitative test, I showed that McNamara test would not be valid because this is for qualitative, that was for a quantitative variable. So if it's more than 2 samples, it's the Friedman test. Next, if it's an unpaired sample, if it's 2 samples, if it's going to be a chi-square test or a Z test, and more than 2 samples, chi-square test. So chi-square test works if it's 2 samples or more than 2 samples when it's unpaired. So this is for qualitative. Next, quantitative is going to be interesting and it's something that is most commonly going to be asked. So the type of hypothesis that you're going to be testing. First is you're going to check whether there is a relationship or an association between 2 variables. And if both the variables are quantitative here, in this case, normal distribution. So if it's a normal distribution, we're going to be checking if there is going to be a normal bell-shaped curve, or if it's going to be not normally distributed, that means it's going to be either skewed to the left or skewed to the right. All right. Now, the normal distribution, if present, we're going to be using Pearson's correlation, and if it's absent, we're going to be using Spearman's correlation. So we can just imagine that the spear is pointed to one side, correct? So it's skewed. You're going to use a spear to skewer, So a Spearman's rank correlation is going to be used if the distribution is skewed or if the normal distribution is absent. All right. Next, difference between the means, whether it's significant or by chance. Again, we check for normality. Now, if normally distributed, if it's present, so we take the paired sample, we take a paired t-test. That was what is the example we followed back then, correct? Next, unpaired samples, if it's 2, that means if there are 2 groups, if the sample size is less than 30, we're going to be having student t-test or unpaired t-test. Next, or you can use the Z test for difference between 2 means. If it's more than 30, we use a Z test. You see, for each kind of branch in this entire logic, there will be so many different questions framed. Now, if you have this specific flowchart onto your head, you will be easily able to answer so many questions related to test of significance or test of association. Okay, so make sure that you really pay attention and grasp as much as possible of this. Next, if it's more than 2 samples, we use the ANOVA, analysis of variance, and if the result is significance, we use something called as a post hoc test, where you use the Tukey's or Bonferroni's correction. So basically, it's like if you have 3 groups, and it's come as analysis of variance test is significant. Now we need to check which among these three is the most significant, because the whole overall value would be given as significant, but we need to see whether it's group 1, group 2 or group 3 which is more significant when compared to the other two. So that is done with the post hoc test. That's the main significance of it. Okay. Next, moving on, when there is an absent normal distribution, when it's skewed, we use a paired sample. If it's present, we use a Wilcoxon's-Matz paired test. If it's unpaired, we go for 2 sample. If it's present, we use a Mann-Whitney-U test, or if it's more than 2 samples, we use a Kruskov-Wallis test. I know they're all named specific tests, but if you follow this flow chart and you read it a few times, it becomes second nature and you'll be easily able to answer all the questions related to tests of significance and get a clear understanding on what you need to write. We will move on to question number 2. In a case control study investigating the link between vitamin C intake and the occurrence of respiratory illness, which sequence best represents the order of steps conducted? So it's a case control study. So first, logically speaking, without selecting cases and control groups, you cannot do anything, correct? So first, this has to be number 1. We have to select them. Next, we need to match them on whether they are cases or controls. After that, we need to match them. What does matching mean? They need to be of the same other risk factors. So they may be of the same age, they may be of the same gender. So we need to match them that they're all similar in those aspects. Okay, they may be having similar occupations. So except for the exposure, all the others should be pretty much the same. That's what they're trying to look at. So next, you'll make sure that they are matched. So this will be number 2. After you've matched everything, now you see whether the cases and controls, you see how much of the exposure they have undergone. So again, the third one would be measurement of exposure. Post that, we collect all the data. Next, it's time for the big analysis. So analysis would be step 4. First, we select cases and control groups. Next, we match them for all the common variables like age, gender and occupation. Third would be the measurement of the exposure, both quantitatively and qualitatively, as well as for the analysis. So the order then would be followed is 3, 2, 1, 4. The option A would be the correct option. Moving on to question number 3. Which of the following diseases is most appropriately represented by the submerged portion of the iceberg in the given illustration? So tetanus, influenza, chickenpox and rabies. Again, tetanus, asymptomatic individuals are very, very unlikely, so that is ruled out. Rabies, again, there are no subclinical or invisible cases. Chickenpox as well. So varicella, again, it has a very high infectivity and there are very few individuals who will have asymptomatic varicella. So influenza, there are so many subclinical cases of influenza where they can still spread the illnesses, but at the same time they are not clinically apparent. So they would fall under the invisible part of the submerged portion of the iceberg. So influenza would be the right answer in this case. So coming to question 4, what does the red line represent in the given graph? A is death rate, B or birth rate, C is total population, D either death rate or birth rate. Now, we are seeing that among the red and the green lines, the red one is the one that is immediately declining. Now, if the healthcare situation of a population improves, the first thing that declines is going to be the death rate, following which, after many years, then the birth rate starts to decline due to better understanding about family planning and then better education. Then the birth rate drops. But initially, the death rate is the one that immediately declines. So the correct answer would be option A, which is the death rate. Now we can see in this image here, the first thing to drop would be the death rate, followed by the birth rate, and then we see the overall population that is growing here. We see the different stages, the high stationary, early expanding, late expanding, and the low stationary, and then the declining. So the declining would be the 5th phase in this case. Next, question number 5. In the context of a sudden onset disaster, which phases are included under the recovery stage? We can have preparedness, response, rehabilitation or mitigation, or option B, which is response, rehab, and mitigation only, or we can have response and rehab only, and D is preparedness and mitigation only. The answer here is response and rehab only, because if we just go through this diagram, which is given in PARC, so there's going to be an impact of the disaster, and under the recovery phase after a disaster, so we would first respond to the disaster, go to the site, do immediate triaging, and search and rescue for all the cases, and then we do the rehabilitation, both nutritionally, both sanitation-wise, vaccinations, and food, and infrastructure as well a little bit, and then there is the reconstruction. So here reconstruction word is not included, so the most appropriate answer would be the response and rehabilitation, which is given in option number C. Now moving to question number 6. A pharmacist randomly selects samples from 3 categories of medicines: plant-based, animal-derived, and synthetic. What type of sampling method is used in this scenario? Now coming to this logic, let's have a look here. This is an image. So first here, there are 3 categories, 1, 2, and 3. And then you're selecting appropriately from each. Alright? So you're getting 1 here, 1 here, 1 here, and 1 here. So this is something called as stratified sampling. Here, this is randomly choosing any one person out of the population. So this is a simple random sampling. Next, this is sampling every third person. So you're systematically selecting 2, 5, 8, and then 11. So this is called as systematic sampling. Here, there are 2 separate groups, There's one group here and then another group here. And then you're choosing from there one sample and then another from the second cluster. So this is called as cluster sampling. Now, the sampling method here employed in this case is they are dividing it into different strata. So hence it's going to be a stratified sampling, wherein they're going to be stratified into plant, animal, and synthetic based medicines. Coming to question number 7. What is the use of the device shown in this image? Okay, first we need to identify what the instrument is. This instrument is a Carter thermometer. So Carter thermometer is used to measure the cooling power of the air. Cooling power of the air, it's able to measure the simple movements of the wind as well, so it measures the cooling power of the air. And the other options are, there's a 6's maximum and minimum thermometer, which is going to measure obviously the air temperature here, and then the air humidity by a hygrometer, and the radiant heat by a globe thermometer. So the correct option would be cooling power of air by the Carter thermometer. Question 8. A student was preparing a presentation with data charts but mistakenly lost the titles while editing. Given the parameters in the chart below, which index does this chart most likely represent? So the parameters are mean life expectancy, expected years of schooling, mean years of schooling, and gross national income. So all of this is going to be a geometric mean which you're going to be obtaining by all of these measures finally to arrive at the human development index, which is between 0 and 1. So the correct option is human development index, and our current score is 0.67. So HDI is the correct answer in this case. Coming to question 9. A homeless man presents with symptoms including diarrhea, dementia, and dermatitis. Obviously, it's going to be the 3 Ds. He occasionally consumes alcohol and reports maize as his primary food or staple. What is the most likely diagnosis based on this information? Now, obviously, we know this is the Cassell's necklace. Alright, Cassell's necklace. So, the answer would be niacin deficiency, which is also called as vitamin B3. So, this is a straightforward question with the image as well as the classical history. Next. The motivation model of health education. What is the third stage for adoption of new ideas? Besides, first you get awareness, then followed by motivation. Then the third one, after you're motivated, what do? You act. So the answer would be action. So the correct option here would be action. All the other options are not part of the motivation model. So action would be the correct option in this case. Coming to question 11. A disease has an incubation period ranging from 3 to 14 days, with a median incubation period of 10 days. After traveling abroad, a person who has not vaccinated is now required to be quarantined due to the international significance of the disease. How long will the person need to be quarantined? Now, as per the rules of quarantine, we need to specifically quarantine the person for the maximum incubation period of the disease, which is known. So the minimum would be 3 here and the maximum incubation period is 14. Median incubation is 10 days. So the given options are the median incubation period, no. This is twice the incubation period, no. 20 days is wrong. So 14 days would be the right answer, which is the maximum incubation period of the disease. Coming to question number 12. In a population of 30,000, there were 500 live births and 14 stillbirths in the year 2023. Of the 18 children who died before the age of 1 year, 12 passed away before reaching 28 days of life. And among these, 9 died within the first 7 days. Calculate the early neonatal mortality rate. Now, an early neonatal mortality rate is from day 0 to day 7. So, within the first 7 days of birth is what classifies as an early neonatal mortality. Now, if there are 9 out of the total 500 and we calculate it, so all of this is per 1000, alright? So, if you were to calculate it, so if we have early neonatal mortality rate is equal to, so the early neonatal mortality rate is given by 9 divided by 500 into 1000. So, this is into 2, so we would get it as 18. The correct option here would be option B, which is 18 per 1000 live births. That is the correct answer here. Coming to question number 13. A 37-year-old woman from Bihar presents with fever and significant weight loss over the past 6 months. Examination shows splenomegaly and blood levels reveal anemia, thrombocytopenia, and hypergammaglobulinemia. What is the vector of organism causing her condition? So this looks like a classic case of Kala-azar. So if Kala-azar is the case, so the vector of the organism would be the phlebotomous species or the sandfly. The Aedes again would not be involved here, the mite would not be involved here. So this would be scrub typhus for the mite, female Anopheles mosquito for malaria, and the Aedes mosquito for dengue or chikungunya. So we have the images here as appropriate. So this would be the sandfly and this would be the Aedes mosquito. We can see the tiger stripes, and then we can see that this is the Anopheles mosquito with the near straight and vertical position of the mosquito, and this is the mite which causes chiggers, or it's going to be chiggerosis, or it's going to be scrub typhus. Question 14. In the device shown below, which vaccine would be placed in zone 3? So it's the lowest part of the entire ice line refrigerator. So we have pentavalent, hepatitis B, OPV, and DPT. So we keep the live vaccines usually towards the bottom end, and OPV is supposed to be very heat sensitive, and hence we're going to be going with OPV here. OPV would be the correct answer. Coming to question 15. In a town, 1000 live births occurred over a period of 6 months. During this time, 12 women died from the following causes: sepsis, RTA, obstructive labor, postpartum, and snakebite. Now, MMR, maternal mortality ratio, includes only those which are due to obstetric causes. So we have to rule out all non-obstetric causes. So an RTA can happen to anybody, right? So RTA is ruled out. The snakebite can happen to anybody. So snakebite is ruled out. So you just add up only those which are related to obstetric causes. So 3 sepsis deaths here, 2 obstructive labor deaths here, that adds up to 5. And then postpartum hemorrhage is about another 3. So a total of 8, correct? So if there are 8, now maternal mortality ratio is going to be given by the total number of deaths which are occurring due to maternal causes. That's going to be 8 divided by total number of live births is 1000, and it's going to be per 1 lakh live births. Per 1 lakh live births, correct? So you just cut out the zeros. So you're going to be getting 800, which is given as option A. Coming as question 16. A 35-year-old homeless man presents with a 1-month history of fever, cough, and weight loss. Both sputum smears for tuberculosis came out negative, but a chest x-ray suggested TB. According to the latest NTEP guidelines, what should be the next step in managing this patient? So we'll have a look at this flowchart, which is a diagnostic algorithm. So a presumptive TB patient, we do the smear and the chest x-ray, and they specifically care that chest x-ray is positive, whereas sputum smears is negative, correct? So when we just check here, among all of these options, we can say that the smear is negative, but chest x-ray is suggestive of tuberculosis. So the next logical step would be to go in for CBNAT. Because the option here is not to repeat sputum smears, no line probe assay, don't wait for the TB cultures, it's going to take a lot of time, and the gold standard would be to ask for cartridge-based nucleic acid amplification test, which is a CBNAT. Coming to question 17, the research is being conducted to find the association between aniline dye exposure and bladder cancer in workers who have worked in the industry for more than 20 years. Two groups are formed. One group consists of workers directly involved with dye handling, and the other group consists of office clerks not exposed to the dye. So there is exposure, no exposure. The years of occupation are noted from the records. Okay, it's from the history. What type of study is being performed? Since we're going back in time to see the exposure leading to the disease being bladder cancer, exposure being aniline dye exposure, it's obviously going to be a cohort study. So it's either A or a B option. Now, since we're going back in time, it's going to be retro. So it is a retrospective cohort study because you're going to go back into the records and seeing currently if they have cancer or not. Prospective would not be this case here because they're not starting out right now with the exposure. They've already been exposed. Case control study doesn't apply here, and intervention and response, again, it's not a trial. Question 18. 30-week pregnant woman presents with complaints of reduced vision at night. She mentions avoiding papaya, mango, and other fruits during her pregnancy, fearing that they could cause an abortion. Which of the following healthcare workers has the primary responsibility to provide counseling and accurate information to this patient? The person who comes in first contact with this pregnant woman would be the one responsible. Now, the ones in the field who talk to the people and are part of the whole community and are on a regular basis maintaining registers are the ones that are going to be the ASHA workers. So the ASHA workers are the one who would be telling them on the accurate information of this patient, who are going to be the primary responsibility to provide counseling. Following which, if they feel they're not able to convince or if they really require further care, they would be required to talk to the ANMs. Coming to question number 19. A 22-year-old female visits the STI clinic with mild vaginal discharge. On conducting a speculum examination, cervical erosions are observed. Based on the findings, which STI kit should be provided to this patient? So, when we have a look at the different kits available, now if there is a specific cervical discharge, now there are cervical erosions, means that the source of the discharge would be coming from the cervix. So, we need to ask about the nature and the type of discharge, the quantity, color, and odor, the burning while passing urine, increased frequency, genital complaints by sexual partners, or if there any type of low backache. So since it's a clear case of cervical discharge, we have to go in for the kit number 1, which is the grey kit, which contains 1 tablet of azithromycin, 1 gram. They have to take it immediately, followed by another tablet of cefixime 400 milligrams, again to be taken immediately, and they have to treat the partners when they are symptomatic. There are specific other instructions which are also to be given to this specific lady, wherein we have to say that so they have to be explained about the STI or the RTI, safer sex practices, and importance of taking the complete treatment. And they have to be treating the partners, especially when they're symptomatic for this case, and they have to be sexually abstinent, or a condom should be used during the course of the treatment, and we have to be providing them condoms and educate them about the correct and consistent use. Refer all patients to integrated counseling and testing centers to rule out any other serious sexually transmitted diseases or infections like HIV or hepatitis B as well. So also they need to be followed up after 7 days for all the STIs. And if the symptoms persist, assess whether it's due to reinfection and refer them promptly. And also, we have to consider immunization against hepatitis B for such patients. So, coming to question number 20, what is the most appropriate cause for the loss of years of potential life in the following context? Option A, years lost to morbidity, B, years lost due to premature death, C, years lost to disability, D, years lost to poor quality of life. Now, we see that disability adjusted life years is a measure of overall disease burden expressed as the cumulative number of years lost due to ill health, disability, or early death. So, it's given as years lived with disability plus years of life lost. Now, cardiovascular disease is the most serious cause of mortality across the world, accounting for almost 65% of deaths. So, it's years of life lost, which is basically a premature death, which is the major cause of DALYs. So, the answer here would be the years lost due to premature death, because the most common cause of death are the ones that cause premature death, which is cardiovascular diseases. Coming to question 21, in a 10-year-old child, which of the following vaccines is administered as part of the school immunization program? Focus that it's a 10-year-old child. So, we're going to be having a look at the specific immunization schedule. Let's have a look. So, the child is going to be 10 years old. So, all of this is at birth, 6, 10, 14 weeks, 9 to 12 months, 5 to 6 years. And when we come down here, it's going to be 10 years and 16 years. It's going to be TD, which is tetanus and diphtheria as well. So we're going to be giving 0.5 ml of that intramuscularly in the upper arm. So TT or a TD vaccine would be the correct option in this case, because it's going to be focusing on a 10-year-old child. Make sure to be well updated with this specific vaccination schedule. And the latest update in this case is all about the IPV, which is fractional IPV. We're going to be giving it at 6 weeks, 14 weeks, and 9 to 12 months. Remember that. So FIPV is the latest update among this. So make sure that you reread the National Immunization Schedule. It's part of community medicine, pediatrics, and the list among many other specialties as well. Coming to question number 22, a young male presents to the hospital with a clean-cut wound without bleeding. He has received a full course of the tetanus vaccination 10 years ago. What is the best management for this patient? So options are human tetanus immunoglobulin and full course of vaccine, human tetanus immunoglobulin only, single dose TT, or a full course TT. So the prophylaxis is given based on these 4 categories. Or category A is we have to see whether they have received full immunization or a booster dose within the past 5 years. Option B is full immunization or a booster dose between 5 to 10 years. C is full immunization or booster more than 10 years ago. D is never taken immunization or it's unknown. Now, the category here is that it's a clean wound and that the patient had received it 10 years ago, right? So let's keep it as category C. Okay, category C here, whether it's clean or unclean, it's a clean wound. So the clean and wound and the category C, that you need to obviously do wound care for all cases, and we need to give a single dose of TT. Let's check out with the options here. Option C has a single dose tetanus toxoid. So option C is the correct answer. Coming to question number 23. A boys' hostel has an outbreak of fever cases with headache followed by the development of pleomorphic rashes sparing the palms and soles. What is the next best step in the management of suspected cases? So this looks like a case of varicella zoster immunoglobulin. So what we can do is option A would be isolate for 6 days after giving acyclovir, followed by VZIG within 3 days. Isolate for 12 days after giving acyclovir, followed by VZIG within 48 hours. Third would be to just isolate them for 6 days or to only give varicella zoster immunoglobulin. Now, among the children itself, the chickenpox is self-limiting. So the main thing would be to not allow the spread because it's a very infectious condition. So the best thing would be to symptomatically manage, not to give any antiviral drugs unless there are certain complications, and to just simply symptomatically manage them and to mainly isolate the affected boys for a duration of 6 days. So the correct option is option C. So again, these are the pleomorphic rashes in different stages of evolution, and they are sparing the palms and the soles. Now, in the STEP approach by WHO, this is a STEP manual, it's called a STEP manual for non-communicable disease management. Which of the following step is not included? So basically we are assessing them for the risk of non-communicable diseases. So options are therapeutic assessment, physical assessment, biochemical assessment and behavioral assessment. So the main three things that are done in the STEP approach would be the behavioral assessment, where they check for tobacco use, alcohol use, their diet and physical activity, and the physical assessment where we measure their blood pressure, height, weight and their waist circumference. The biochemical assessment, we check for their blood glucose, blood lipids, urinary sodium and creatinine. So among these, therapeutic assessment is not done. So the correct option would be the therapeutic assessment, whereas the other three are already done. Next, question 25. Which of the following best describes the criteria for establishing an urban community health center? A. Serves a population of 1 to 1.5 lakh, acts as a referral center for 2 to 3 primary health centers, no sub-district or district hospital available in the area. D. Must have a 100-bedded facility in metropolitan areas. Now, what we know about an urban CHC is that it is a 100-bedded facility in the metro city. So, and an urban CSE acts as a referral center for 4 to 5 urban primary health center. Keep that in mind. So then when it comes to metro cities, it caters to a population of 5 lakh with the 100-bedded facility as already mentioned. And the sub-district and district hospitals operate in addition in CHC to cater to the population. Alright, so which of these best describes it? So it must have a 100-bedded facility in metropolitan cities is the correct answer, because here it tends to 5 lakh and this is for 4 to 5 PHCs, and this is wrong because it coexists and acts as a referral center. Question 26. Community is suspected to have a higher incidence of acute lymphoblastic leukemia due to possible exposure to cytotoxic waste in the water. A case control study is being conducted to determine if the chemical exposure and ALL are associated. What group should serve as the control group in this study? Now, a control group is going to be matched for age and gender and occupation and other things, and the control group should not have any exposure. That is the main characteristic of control group. So who are exposed, children who are exposed but unaffected with disease, nope, they already have the exposure. Children who are not exposed and are affected with the disease, so if they already have the disease, they cannot be controlled, because that would be a case then. Then children coming to your OPD who do not have the disease. Fourth option would be all children with ALL irrespective of exposure status. So again, this would be a case. So option C would be that they're coming to the OPD with similar characteristics, who do not have the disease and they don't have a known exposure. Question 27. An auxiliary nurse midwife is tasked with conducting a vaccination camp in a village. She is provided with 2 open vials, one containing pentavalent vaccine and the other an MR vaccine. What is the most appropriate course of action for the utilization of these vaccines? So this is a question on open vial policy. So option A would be to use the MR vaccine and discard the penta. B would be to use the penta and discard the MR, or use both or discard both vaccines. So as per the open vial policy, the vaccines which do not follow the open vial policy are measles and rubella, MR, Japanese encephalitis vaccine, BCG vaccine, as well as rotavirus. So among these, we know that there's a pentavalent here and an MR vaccine. So we cannot use the MR vaccine once it's open and kept for some time exposed to the outside. So for that reason, we can use the pentavalent vaccine as long as it follows the open vial policy, but the MR vaccine has to be discarded. So option B would be the correct option. Coming to question number 28. Which of the following thermometers is used to measure the low air velocity rather than the cooling power of air? So we have the dial thermometer, wet lobe thermometer, blow up thermometer, and the Carter thermometer. So the Carter thermometer can be used to measure the cooling power of air, as also it can be mainly used to measure the low air velocity. So the cooling power of air, because it's so sensitive, it can be even used to measure the low air velocity. So it can be used more so for the low air velocity rather than the cooling power of air. Now the dial thermometer specifically for the temperature purpose, globe thermometer for radiant heat, and this is going to be the wet thermometer, which is basically the wet globe thermometer. So this again is not going to be measuring the low air velocity. This would be the Carter thermometer, which is going to be using. So the Carter thermometer would be the one that is going to be measuring the low air velocity. Question 29 is, monetary benefit is measured in which of the following analysis? Input-output analysis, network analysis, cost-benefit analysis, and cost-effectiveness analysis. Now we need to see which are the economic evaluation analysis methods here. So cost-benefit and cost-effectiveness are the only two which are going to be focusing on the cost or on the cost aspect of it. Whereas network analysis, we will be explaining here, wherein relationships between different entities, such as in project management, would be focused on network analysis. Input-output analysis focused on inputs on the resources versus the products and services without monetary aspects, whereas cost-effectiveness analysis focuses on cost per unit health improvement, cost per life save, or DALIs. So it's going to be a unit which is going to be focused on, whereas the pure monetary benefit is going to be focused on in the cost-benefit analysis. That is the correct option here. Coming to question 30, the air pollution index chart of 4 consecutive days in Delhi station is given below. The air quality index of November 23 is classified as what? So AQI here is 407. So is it going to be moderately polluted, poor, very poor, or severe? So let's just have a look at what is the classification that we have going on. So 0 to 50 is good, 51 to 100 is satisfactory, 101 to 200 moderate, 201 to 300 is poor, 301 to 400 is very poor, 401 to 500 is severe. Unfortunately, we have crossed the limit of 500 when it comes to Delhi's pollution, and in this case, it is a value of 407 here which we see, hence it is severe. So AQI is severe for November 23. Next, question 31. A 40-year-old man from Chhattisgarh present with progressive muscle weakness and leg spasms. Pure motor paresis was seen on examination. What is the most appropriate history to be elicited in this patient? So Chhattisgarh, it is classically a more agricultural based with relatively low socioeconomic status, and they have progressive muscle weakness, a 40-year-old and leg spasms as well. So pure motor paresis was seen. What is the most common history? Now there's a history of fever we can check for, history of vaccination, history of similar illness in the past. Now, considering that this is a public health related question, we would be seeing that we have to see the history of diet, because there could be a history of intake of kesari dal, which can lead to neurolathyrism, and it leads to this stages, that is from no stick to 1 stick, 2 stick, and the crippling stage as well. So history of diet is very important in this case to be elicited for ruling out toxicity due to kesari dal leading to lethyrism. Question number 32, this is the last question. The variation in a data set is compared with that of another data set using either standard error of mean, standard deviation, coefficient of variation, and variance. So standard error of mean basically compares how the mean of the sample varies with respect to the population. So it doesn't check between two data sets. It checks only between the sample and the population. Standard deviation, again, it checks how much that specific value is deviating from the sample mean. So it's within the same sample as well. Next, variance here would be standard deviation squared. So again, it is not going to have a direction, it's just going to be a squared value of the standard deviation. So standard error of mean is ruled out, standard deviation is ruled out, variance is ruled out. Now, when it comes to the coefficient of variation, it is basically by coefficient of variation is given by standard deviation by the mean. So it shows that how one sample's standard deviation and mean is compared to another sample standard deviation and mean. So the variation in data set to that of another data set. So the correct option is C, coefficient of variation. I hope this session was useful. We'll be happy to look at more such videos and understanding the basics of community medicine and public health so that we can really put our basics very strong and be well prepared for the upcoming competitive exams. Thank you very much for your time. Hope to see you soon.